before we launch into the slides, I just thought I'd mention that in the past, when we've given a workshop on assessments, we have done one workshop, and it was an awful lot of information packed into one presentation. So we've divided it into two parts. And this part is really going to be more about the process of asking for and getting an assessment and sort of general things to look at during that process. And then part two, and that's going to be more at how you read an assessment report and how you get information out of it, how you interpret some of the information in the assessment report. So we won't be delving into actually understanding some of the data too much today. Today is really more about the process. So with that, I think we will get started. We just start out by telling all of you that we are Matrix Parent Network and Resource Center. And our mission is to empower families of children with special needs to successfully understand and access systems that serve them. One of those systems, of course, being the special education system, which is relevant to what we're talking about today. And our goal is to make all of you successful advocates and role models for your children. We don't serve as advocates for parents. We try to teach you to be advocates so that you're comfortable and confident participating in the process and advocating for your own child. And this is just the designations that we have. We get some funding from the federal government and from the state government, and we serve different counties throughout the North Bay and Northern California. But if you're not from one of those counties, that's fine. Our online trainings can be accessed by anyone, and the information is pretty much relevant throughout the state of California. And we also just want you to know that while we try to make all of our services free to parents, that if you are willing and able to make a donation, we would gratefully accept that. This link is live in the PDF that you should have received with your registration, and you can also go on our website and donate. We gratefully accept all donations. So we'll introduce ourselves a bit at this point. My name is Margaret, and I'm a senior parent advisor at Matrix, and I've been with Matrix about 10 years now. I hate to say that it's been so long, but I joined Matrix when my kids were in middle school and both going through the assessment process. My kids are now young adults, but I've been through many IEP meetings and assessments and reviews for my own kids and for many parents that I've worked with as a Matrix parent advisor. And my co-presenter today is David, and he will introduce himself briefly.
Okay. Hi there. My name is David, and I've been with Matrix a little over a year now. And I came in involved with Matrix a little differently than Margaret. I'm a retired director of special education for a variety of school districts around California. I also taught at a California State University for many years. I do have a granddaughter with autism, and I've spent years when she was younger advocating for her with the school district. So after I retired, so I've been really on both sides of the table, and I've attended many IEPs as a professional, probably about 2,000 IEP meetings over the course of my career, and many with my granddaughter as well. So like I said, I have a little bit of experience from both sides of the table. So with that, so let's talk about what we're going to do today. So what you're going to leave here knowing, hopefully, and that's the why, the how, and the when to ask for an assessment, and then assessment timelines. And I'll say that the special education process is rather strict in terms of timelines. These are all federal laws that govern it, and the timelines are they're pretty important in the whole process. What elements assessment should include, how assessments lead to special education eligibility and developing an IEP, how you can participate in the process. And it's important to note here that if you're new to the process, that a parent is considered a full member of the IEP team. You're not just a person that's having information presented to, you're an integral part of the entire special education process. And then also what to do if you disagree. And there's a very formal process with that, and we'll go over that also. So let's talk about, first of all, what assessments are. So by definition, an assessment, a good definition for an assessment is that it's an evaluation or estimation of the nature, quality, or ability of someone or something. An assessment is the process of evaluating your child's strengths and weaknesses as they affect his or her ability to benefit from their education. So if you notice in that definition that we talk about weaknesses, but we also talk about strengths. So an important part of special education is not only recognizing and identifying strengths, but to use those to help a student access their education. So what happens with special education is that we try to accommodate or modify things to the degree that a student's able to get past those things that are their weaknesses, so they're able to access their education. But it's very important that we build in strengths to their program as well, because those strengths are going to be what they rely on, not only in school, but certainly for the rest of their life. So it's really a matter of getting past those weaknesses and the ability to be able to use a student's strengths. So why get assessments? So assessments help the IEP team determine eligibility, not diagnosis, which we're going to talk about here in a second, in any area of suspected disability. And that's an important point we'll talk about also in a minute here. And assessments are the foundation of an individualized education program, or an IEP. So notice that we said that assessments help determine eligibility, but not provide a diagnosis. So disability doesn't necessarily qualify our student for special education services. The determination for eligibility is made when the disability interferes with a student's ability to access their education. So let's talk about an example. We talk about, for instance, with autism. Just having a medical diagnosis for autism doesn't necessarily mean the child's going to qualify for special education services. That disability, that autism, has to interfere in a material way with their ability to be able to access their education. And that's really the key term. So the disability interfering with an appropriate education is really the key. So let's take a look at just one other quick example. A medical diagnosis for ADHD is specifically excluded from the law for special education. So rather than looking at a medical diagnosis of ADHD, we look at issues like attention and focus, which are obviously symptoms of ADHD, but not actually the diagnosis itself. Rather, the problems with attention and focus and how they interfere with schooling is the key. And interference is, and I have to point out, not only relate to academics, it's really all activities that take place in education. So if a child is having issues with socialization, for instance, or if they're having issues with mental health issues, or anything to do with extracurricular activities or unstructured times, it doesn't have to be necessarily academics that qualify for special education. It's really the whole range of experience that a child experiences at school, which is taken in by the field of assessments. Why get assessments? So the next slide, Margaret. So to identify needs and strengths, again, we talked about that, to track progress, which is critically important. So a parent can request assessments at any time during a student's school career. It doesn't have to be just to determine eligibility. It could be for a variety of reasons. And then assessments, of course, are used to develop the IEP. So assessments provide both a baseline and a guide to progress. And having objective, not subjective, but having objective data to determine not only eligibility, but to guide an IEP team's planning is a major part of the assessment process. So note that parents can request assessments at any time. For example, let's talk about a student that's not progressing in reading skills. Although there's no indication why that might be happening. It could be that a student tested okay in first grade in terms of the ability to decode language and the ability to know sounds and letters and so on. But by doing assessments that look at things like short-term memory or attention, as a couple of examples, we may find that there's factors that weren't obvious in the original assessment and things that are impeding a student's progress that we just don't think about as strictly related to the, the physical act of reading. Okay. And so how do we ask for assessments? So there's very important that you put, if you're requesting the assessment, that you put your request in writing. That districts, a lot of times that a parent will ask a district for an assessment and verbally, and nothing happens, and it may not because it's legally you need to put that request in writing. An email is fine. It doesn't have to be a formal letter. We have a sample letter on our website that you can take a look at, but it's not a huge deal. You can basically say that your child is experiencing problems in school with socialization or academics or whatever, and that you suspect there may be a disability and you're requesting an assessment. So it doesn't have to be anything that's technical, because you're not supposed to be an expert in this. You're supposed to just be, someone who's seeing that there's issues. Once the district has your request, your written request, they have 15 calendar days to respond. And if approved, the district will give you what's called an assessment plan to sign. So an assessment plan is a form that lists the areas to be assessed, but they're not going to necessarily name the individual tests that they're going to provide. Now, what you can do is that you can request in writing what the actual tests are going to be that are being used to give to your child. But in the assessment plan itself, it's a relatively simple form that knows specific areas that they're going to test in, like social emotional areas, health, academics, and so on. So once you've gotten the assessment plan in hand, then we'll talk about timelines in terms of I'll tell you the timeline now is that you have at least 15 days to decide if you want to sign the assessment plan and return it to the district. So there's not a specific amount of time that you have, but you have at least 15 days to return that. And then once you sign the assessment plan, and once the district has it back in their hands, then they have 60 calendar days in order to complete the assessment and to hold an initial IEP meeting. And again, we talk about timelines as being set in stone. These are specific timelines that by law have to be met. So you can request reports prior to an IEP meeting. I'll talk about why sometimes you may not get them in a minute here, but ask nicely, because they may respond to you with more positively. And if you like, and you get the assessments before the IEP, as parent advisors, we're happy to review those assessments for you and to give you ideas as far as goals and what we think of the assessment plan, and so on. Or we're happy to take a look at the assessment after an IEP, and we're happy to look at the IEP and the whole package if that's what you want us to do. So how to ask for assessments? So if a request for assessment is denied, the district must give what's called prior written notice, and that's a term in the law that basically applies to kind of any communication that a district has, formal communication that a district has with a parent when they're either approving something or denying something. So you'll see that term prior written notice quite a bit in special education, and has to include the reasons for the denial and the data used for that denial. So if you send in a request for assessment and the district responds to you with an email saying, we decided not to assess at this point, we want to take a look at what's going on for a little bit longer, that's not adequate. There has to be specific data in there that justifies the denial of the assessment. So this process in terms of requesting an assessment and the 15-day response from the district, and then you're approving it, that's the same no matter how many assessments or what time you ask for assessments, no matter if it's your first time asking for an assessment or the 10th time you've asked. And you can and should, it's a very good idea, request reports prior to an IEP meeting in writing. So as I mentioned, that school districts are not required, I can't remember if I mentioned that or not, they're not required to provide assessments prior to an IEP meeting by law. However, it's much better practice if they do. You can imagine that, well, I can tell you in my own experience with my granddaughter that I've walked into a couple IEPs not having seen the assessments before the IEP, and as many IEPs as I've attended and as many times as I've analyzed data in IEP, it's very difficult when you're sitting with 10 people around a table trying to figure out exactly what that assessment says. So for a parent coming in that may not be as familiar with this process, it's a very difficult thing to do. So and again, mentioning the fact that parents are an integral part of the IEP team is really crucial for you to be able to fully understand the assessments so that you can actually help create the IEP. So a lot of times, if you go into an IEP and you don't have the assessments beforehand, you are going to need a second meeting so that you've had a chance to digest it. It's a good idea, of course, to go on with the meeting because the professionals there can explain what's in the assessment and give you an idea of what's there. But you're often going to need a second meeting to complete the IEP. Not always, but that is the case. I'd say a significant amount of the time. So some of the reasons that school districts don't do this, they're really not trying to hide anything from you, in my experience. What I've seen many times coming into an IEP meeting is that the psychologist or speech and language pathologist is actually writing on their computer the end of that report when they're at the beginning of the meeting. And a school psychologist may have a significant number of assessments to do. You'll find that speech and language pathologists sometimes have caseloads that are over 50 students. So, schools aren't trying to withhold information from you. So they know that an informed parent is going to be a much better partner than a parent that thinks that they're having information kept from them. The importance of you being the IEP is that you know your child the best. Professionals can do all the testing that they want, but they're not familiar with that child on a day-to-day basis. And you bring things to that team that nobody else can bring. And so you being a really fully participating member is incredibly important in the IEP. So you know your child the best. Okay. So when to get a So obviously, the first time that you're going to have an assessment is when a child is initially going into special education. So for an initial IEP, there always has to be an assessment provided at that time. And assessments most of the time have to be done triennially, which is every 3 years. And so that means that a full reevaluation needs to be completed. Now, the law changed several years ago, saying that in certain rare cases, if a parent in the school district agrees, there does not need to be formal testing for a triennial IEP. But I'll say that's pretty rare. That's usually in the case of a child that may have profound disabilities that things aren't changing in their ability to function at school. So, but it's pretty rare. Almost always in a triennial, you're going to have formal testing to track progress once a year. So when you go into an IEP meeting at the end of the year, there needs to be assessment so that you can know if goals have been met and how far your child's progressed in a year. Assessment can be done at any time if there's a specific concern, if it be academic or if it be social, behavioral, speech and language, whatever. Transition, and that means when your child is starting to go through the transition process from high school into adult life. And best practice for that is that there be some assessment done when they turn 14 years old, but it must be done when they're 16 years old by law, because that's the federal law that governs special education specifically says 16 years old is when the transition occurs. And if a district wants to exit your child from special education, they have to have data that shows their reason for exiting your child. One quick note on that is that your child cannot be exited from special education unless you agree with that. So it's not to worry in advance that a district's going to say your child doesn't qualify anymore. Again, you being a member of the IEP team, you have an equal say in that issue. So at this time, it's a good time to talk about data collection between reporting periods and between IEPs. So when I look at data collection, I refer to it as objective information, not subjective, about things like progress on goals, progress on behavior plans, and even the efficacy of accommodations or modifications. And in my experience as a professional and having overseen special education departments, I'll say that data collection is the area that most professionals fall down most often. I've been in many meetings, and it makes me cringe, is that a teacher or other professional reporting on a goal has a statement like, your child has met the goal and is ready to move on. That's less than a useless statement, because it doesn't tell you what's happened. What is the data? What are the specific observations? What are the specific numbers that tell that professional that your child has met the goal? So it has to include that objective data. Also, in the goals and with the data, the person that's taking the data and collecting it and reporting it needs to be noted on an IEP goal. So there should be a person that's responsible for collecting that objective data. And I will say also that data needs to be provided to parents at the same frequency as report cards and progress reports are given to students with general education students. So typically, progress reports come out elementary and secondary. They come out every probably 4 to 6 weeks. So you should be getting objective data 4 to 6 or 8 times per year about how your child is doing in their program. All right, so let's check and see what we've learned so far. Okay, so the first question has to do with timelines. So a parent tells a teacher that she thinks her son is struggling in school but doesn't know why. She wonders if the teacher can test him. The teacher says, sure, nothing happens for 2 months. The parent is getting frustrated and angry. Did the parent ask for the assessment in the appropriate way? Yes or no? So a school district has 10 days to respond to a parent's request for an assessment. Is that true or false? And again, almost everything in special education, there's a couple of exceptions having to do with the exception I'm going to talk about in a minute, but almost everything in special education is calendar days, not school days. So it's important to know that weekends count. So for instance, just give you a quick example, it doesn't have to do this with this. If you request the records, your special education records from the school district, they have 5 days to respond to you, and that includes weekends. So if you make that request on a Wednesday, they have until the following, Monday, I guess, to get those records to you. So you can almost always think of timeline special education as calendar days. Okay. So a teacher comes to you and says that she would like to recommend that your child have some educational testing, a psychoeducational assessment, and a speech and language assessment. You agree. The school provides you with an assessment plan and you sign it. Evaluators complete the assessments within 70 days from when you sign the assessment plan, and an IEP is held in 73 days. Is the school in compliance, yes or no? My experience as a professional, a school district has to go through what's called a compliance review every 3 years. And one of the big things on a compliance review with the state is how many times have you gone past timelines in the past 3 years? And there's some pretty serious consequences to that, having gone beyond those timelines, including getting compliance complaints, having the state have you write improvement plans, and all kinds of things that are pretty, like I said, significant consequences for districts. So it's serious business if a district goes beyond that 60 days. Okay. So what's in assessments? All right. And so what's in assessments is a good way to look at this is an acronym called CHAMPS. And first of all, that we say that testing and evaluation should address all areas of suspected disability. And we'll talk about that more in a second here. But the acronym CHAMPS can help you think about it. So the areas that are almost always tested in an initial IEP most of the time are communication and cognitive issues. So that's speech and language and like IQ tests, health, and that's actually a school nurse that does the health testing. Academics and adaptive skills. So academics are obvious, but adaptive skills are those skills that allow a child to, an adaptive skill is that they wear the appropriate clothing going to school, that they know how to use a pencil, that they, it's all of those things that that get in their way from being able to access their education. Motor skills are often tested in an initial IEP, but not always. And we'll talk about that in a minute. Perceptual and psychological. And perception has to do with visual perception, auditory perception, and that's a very important part of assessments, and social emotional function. So there's a couple of areas, and I'll go with what's not usually done on an initial assessment. And the reason that a couple of areas aren't assessed initially is because a child can't access special education through certain areas. So a child can access a special education program through two basic ways, through two basic paths. One is called SAI, which is specialized academic instruction. And that can be anything from special education services to behavioral services or anything else that a goal in an IEP calls for. And then the other possible way to enter special education is through speech and language services. So if you look at areas like adaptive physical education or occupational therapy that have to do with motor skills, often those aren't tested on an initial IEP because of a child qualified only for adaptive physical education or for occupational therapy. They wouldn't qualify for special education at all because they don't go through one of the normal paths. So it's good to know that there are just a couple of exceptions to that. But one of the things we talk about is that, let's go to the next slide and we'll talk about the suspected disabilities, Margaret. Actually, no, I'm sorry. Let's go back and let's talk about it. The last one, sorry. So let's talk about suspected disability. So let me give you an example. And we talked about it a little bit before. Your child's having reading problems, and academic testing has come up with no particular reason why your child should be having reading problems. They're not able to, for instance, recall what they read, 10 minutes ago after having read a passage. Well, what might be happening is not the physicality of being able to read, not their ability to be able to decode language or to read letters or to read words. It could be something that has to do with a processing deficit, like maybe they're having an issue with short-term memory. And this is a really common one I've seen frequently with children that are very bright, that this is the child that does really well in coming up with the big idea, but they forget to turn their homework in, or they forget again how to, what a story said that they read a few minutes ago. This is the child that when they get to high school can't remember the formulas that they have to use in like trigonometry and so on. And so those are a processing issue having to do with a specific thing, not having to do with reading. But it's important, critical that we know that sort of thing, because that's going to affect everything else in their academic life. And so not just looking at academic scores, we need to look further. And that's the reason it's so important to look at all areas of suspected disability, not just some. Okay, let's move on. So the primary report, it's often labeled called a psychoeducational report. And you'll see that term in probably 95% of assessments that you do that are done. So what that psychoeducational report includes is the history and background of your student, including all the way back to birth. Were there any issues, in birth? How did the child develop in terms of motor skills and language in their first couple of years? There's a statement about the validity of the testing. There's a discussion of strengths as well as weaknesses, which we talked about before, that it's really important to look at strengths as well as weaknesses. And then recommendations and application to education. So let's talk about validity for a minute, because that's one that gets mixed up sometimes. A lot of factors can affect a score that your child has on a particular test. So let's say, for example, we're talking about an IQ test, and your child is having behavioral issues. And when they were taking the IQ test, they weren't able to focus on themselves paying attention to the IQ test. So what may happen in that case is that they get a lower score than they would normally get if they had been able to pay attention to that. Now, there's ways to get around that. There's different tests that psychologists could give, but that can certainly affect a score on an IQ test. Give you an example that's famous in California, that IQ tests are normally still not given to African-American students, because what we discovered 25 years ago or so through a lawsuit is that IQ tests were culturally biased against students of color. And so their testing scores were significantly lower than typical children that weren't children of color. And so that affected materially how they were treated in the special education system. So factors that affect testing are noted in the reports, and the validity of a particular test, or more than one, needs to be noted so the IEP team can take that into effect. And that's a really important piece. So look for that statement of validity in the assessments. Okay. So the next slide. Oh, no, wait a minute. Is that should include. Did I miss this one? I think I missed this one.
Okay.
So that's all right. So the psychoeducational test should include an explanation of any test done. So what you'll find is that not only are the tests listed, but they're what the test is supposed to report, what the different scores mean, and then the specific scores that your child received are given, and they're giving it in a variety of ways, which we'll go into a lot of detail next week. So tests of intellectual functioning and academic skills will almost always be conducted. For a very young child, there's different intellectual skills tests that will be given that may not have an objective score. They give description of that, and sometimes, and the same with academics, that they'll talk about academics in terms of readiness, sometimes at a young age, instead of where the child is actually functioning. A variety of other tests may be included based on your child's suspected area of disability. And we talked about that, about how important it is to look at the whole child instead of looking at just one specific area. And scores for all students and subtests should be included. And the reason that's important is that you may look at a score. Again, we'll get into this in some specificity next week, but you may look at a score for a child where they score in the average range, and let's say in reading. But if you look at the subtests, you may find that their ability to decode language may be superior, where their ability to comprehend what they're reading may be in a deficit area. So those average, or those scores, if you average them, will come out to the average score, but we're looking at a real issue having to do with comprehension. And that's, of course, obvious to know, because we're going to want to concentrate on that area. Okay. And okay, so other reports can include occupational therapy, which we talked about, physical therapy. Physical therapy is not done a lot in terms of testing for students. Speech and language testing is, I'd say that's included a vast majority of the time in assessments and an ongoing assessment. And then social emotional testing, of course, is very important. At or preferably before an initial or triennial, school will provide you with one or more assessment reports. So again, we talked about asking nicely to get those reports in advance. Again, they don't have to by law do that, but it's much better practice that they should. And you can and should request reports prior to an IEP meeting. And just remember again that a report does not determine eligibility. So a psychoeducational report, I've seen them, and it's not really appropriate, I don't think, is that they say a child may not qualify for special education based on their testing. But that's not up to the psychologist or the other assessor that's doing the assessment. That's up to the IEP team to determine eligibility. And again, you, as being a part of that IEP team, has a significant voice in that determination.
Okay, at this point, we're going to talk about a couple of examples. And so I'm just going to read what we have here as a question. So your second grader enjoys being read to, but doesn't want to try to read with you. Whenever he's asked to read out loud, he shuts down and just refuses. The teacher has also noticed that he's despondent at school and he never raises his hand. So the teacher suggests that he be assessed for special education, and you agree with this and sign the assessment plan that includes academic skills and social emotional testing. Do you think this will be sufficient? Why or why not? The main thing here is that this does not seem to include testing of attention or testing of cognitive abilities. And again, maybe this child has dyslexia or a special learning disability, and would that be caught simply by academic testing? Not necessarily. Many students have trouble learning to read. And so, at second grade, you really hope they're learning to read well, but there could be a number of different reasons they're having trouble reading. And it may not be uncovered just by looking at their ability to read the letters, as David mentioned. There may be something else going on. They may have an attention problem. There may be a social emotional problem. Maybe this child does have an emotional problem. Maybe they have severe anxiety or something. So the social emotional is very important. But the main thing I would say here is that they did not include the cognitive part of the testing. So here's another scenario. You have a sixth grader and they seem to be having trouble with their homework assignments. And this has become more acute because they've now entered middle school and they're dealing with lots of different teachers and lots of different assignments. Your daughter always seems to be cooperative in class, but she never writes down her assignments in her planner. And when you help her get a copy of an assignment from a teacher, she doesn't know what to do with it. And so you've had many frustrating teacher conferences, and now you think, well, my child needs to be assessed. So the school agrees to test for learning disabilities by doing cognitive and academic skills testing. What other testing might you think is necessary? Okay, good suggestion. People talk about including executive functioning and how the child processes information. Great. And those are very good suggestions, but I might add another one, and that is social and emotional testing. If a child is really anxious at school, they're not able to concentrate. And so sometimes the concentration and focus is really a social emotional problem. So that is one thing that you might also want to include. Attention problems, emotional problems, and dyslexia, these things can all appear to be one thing and actually be another when you really get into it, or they can coexist. More than one thing may be happening with the child. So it really is important to tease apart all of these different things. So now we're going to talk a little bit about who's going to do the assessments. So your child may be tested by a variety of different professionals, depending on the area of suspected disability. Now, generally, always this is going to involve the school psychologist and a special education teacher. So the school psychologist is going to be doing the cognitive, social, emotional, behavioral, adaptive skills, processing skills. They will be looking at those sorts of things. And the special ed teacher is going to be looking at the academic skills, the reading, the composition, the math skills, things of that sort. Now, also, many times speech and language is included. And it's important to note that this includes speech pragmatics for kids who may be on the autism spectrum, for example. Speech pragmatics is the social context of speech and language. It's not whether they can pronounce their words or their letters. It's whether they can participate meaningfully in a back and forth conversation. The occupational therapy, as we mentioned, usually this is not part of the first assessment, but if your child has been made eligible and they seem to be having sensory issues, it may be included. And if handwriting, for example, is a problem, is a real problem, they can't hold their pencil and write letters on a piece of paper, then their fine motor skills would be looked at by an occupational therapist. And a physical therapist if there are gross motor issues. Who does assessment? Well, you're going to be involved in the assessment process. Probably someone will interview you and ask about your child's development. And you may get one of these long questionnaires to fill out, things where you have to fill in the bubbles on a scale of 1 to 5. And you would fill that out and send it in. And you need to do that so that the assessment can proceed. And then it's going to be other people based on what the specific areas of need are for the child. So medical professionals, maybe, there may be a diagnosis by a pediatrician that is relevant. And so if you have information from your child's doctor that you think is relevant to the assessment, you should provide that to the school. Now, you're not required to provide any information that you have gathered from an outside professional. That's completely up to you. You have to give permission for any of that information to be shared with the school. Generally, it's best to share all that information with the school. The more is known about how this child is functioning, what's going on with the child, the better you'll be able to build a good IEP. Again, we've mentioned this before, but no single score determines eligibility. You have to look at the entire assessment and take into account the parent's understanding of what's going on. And the IEP team itself makes an eligibility decision, taking all information into consideration. And I was just going to bring up the example of one IEP I participated in, and the child didn't quite meet the criteria for any of the eligibility categories. But they almost met the criteria for eligibility in 3 different categories. And it was clear the child was struggling. So the IEP team said, well, it's okay, that this child wasn't specifically eligible according to the psychologist report in any of these areas, but we can really see this child is struggling. And so we're going to make him eligible anyway. So that can happen. And again, as we've mentioned before, just having the disability doesn't mean eligibility. You have to show that it's significantly affecting their ability to access their education. And again, every area should be assessed. And then we're going to just look at this list. And this is the list of the categories of eligibility. And the thing to look at this is you see that sensory processing is not on this list, nor is ADHD. Both of those could make a child eligible in the category of other health impairment. Other health impairment is any medical diagnosis that would result in your child not being able to pay full attention to what's going on. Many kids that are someplace on the autism spectrum may qualify under speech and language impairment as a pragmatic speech impairment and maybe not even qualify on the basis of autism. Again, it's not a diagnosis that the school is doing. What they're determining is whether your child fits into one of these categories that are defined in the law. And then, as we mentioned before, there's 2 reasons for doing the assessment. One is to determine whether they're eligible, and the second is to provide the information you need to build an IEP. So in the IEP process, you do assessments. The assessments uncover the child's needs. The needs lead to goals on what we hope the child will be able to accomplish over the next year. Based on what we expect the child to accomplish, And this is really what they're helped to accomplish. It's not an evaluation of them, it's whether they're being provided with enough services. So what are the services they need, whether it's speech and language therapy, whether it's behavior therapy, whether it's specialized academic instruction, what are the services they need to be able to accomplish those goals, and then where it all takes place. But the assessments are the basis. That's what's telling you what the child's needs are and the child's strengths are in order to make the rest of the IEP work. So what can you do if you've asked for an assessment or you're thinking about asking for an assessment? What can you do to prepare? Well, the first thing is learn to be organized. And usually one of the easiest things to do is to get a big binder and start putting tabs in it and putting all this information in a big binder so you know where to find it. If you are used to doing all this on your iPad or your computer, that's fine too, if you know how to organize things in that manner. The goal is to have all this information at your fingertips. So when you go into an IEP meeting, or if you're meeting with a teacher, you know where to find all of the information you have about your child. So you might be collecting some work samples, some report cards. If you have reports or letters from doctors or therapists, include those. Whatever observations you have, any emails you've gotten from school, from the principal or from the teacher or from someone else working with your child, and any medical history if your child is on medication. You want to put all that information where you can find it. And usually it's best to share that information with the school. That again is your discretion, your choice, but it's usually better for them to know what's going on. Now, other things you can do. What if you know that your child's been suspended several times, but you don't have a record of that? What if you don't have copies of some of the testing? You can request your child's school file, and they have 5 days. I don't think we've put this in the information in writing on this PowerPoint, but they have to, if you ask for your child's file in writing, the school has 5 days to get that information to you. Usually you can just go into the office and ask for it and they'll make copies of things. But if you're having any trouble, put the request in writing and they must provide that information to you. Read up about your child's disability so you become sort of the expert. Now, special ed teachers and psychologists know a lot about different disabilities, but they don't necessarily know exactly how it's affecting your child. And some disabilities have different ways of affecting children. And some are rare. If your child has a rare disability, it becomes very important for you to be able to communicate with the school. You may know more about it than they do. So make sure you're familiar with how your child's disability affects children generally with this disorder or disability, but also think about how it's specifically affecting your child. Understanding the basics of testing, and we'll go into that next week in much more detail. You also want to just write down your questions, your concerns, so that when you get into a meeting with all the professionals from school, you don't get overwhelmed and forget what you wanted to find out or what you wanted to make sure they knew. So list those down, go into the meeting prepared, and be specific about what your concerns are. If you can say exactly, not just, I'm concerned my child is struggling in school. Say, I'm concerned my child takes 2 hours to do a homework assignment that the teacher said should take a half an hour. Be as specific as you can. Now, if you have outside assessments, you probably want to provide that information to the school. Assessments done by anybody outside of the school system must be considered by the IEP team. They don't necessarily have to act on or do everything that outside assessment recommends, but they do need to understand it and to be able to respond to the information in that report. So if you agree with what you see in the assessments, so you get the assessment report, hopefully before the meeting, read them and see whether they seem reasonable to you. You can write down all your questions so that when you're in the meeting, you can ask the school psychologist exactly what it means. But if you read through it and you go to the meeting and you think, yes, this is a good description of what's going on with my child, then agree with it and you go on and develop an IEP document. If you don't think the assessment decision, if the school has said that the child is ineligible and you don't agree, or if you don't agree with the way they have done the assessment, and you don't have to have a really good reason. If you just read the assessment and it doesn't strike you as being a good description of what's going on with your child, then you might want to take the next step of you sign the IEP document saying you disagree. When you sign an IEP document, you can either agree with everything in the document, you can disagree with everything in the document, or you can agree with parts of it and not other parts. So you can disagree with the results of the assessment, and you can then do a couple different things. If you don't think the school district did a complete job, if they missed something, if they didn't do a sort of testing that you think needs to be done, you can simply ask them if they'll do some additional testing or some additional subtests of the test. You can just request that they do more. The other thing you can do is request an independent educational evaluation at public expense or at district expense. One little point to bring in here is that it's a school district, not the individual school, that's responsible for special education. So it's usually some district employees, like the school psychologist is often not attached to the individual school. They often serve several schools in the district, and it's the district that's responsible for doing this. But in any case, if you think the assessment was not done as well as you think for some reason, and again, you don't have to give a reason, you can request this independent educational evaluation at district expense. Then what happens is that the school district would probably give you a list of people that they can contract with outside the school system, private individuals who will do an independent evaluation. And you would choose one of those. You can actually choose somebody else, but it is a little more effort to choose someone who's not on their list, and have them do an independent assessment and gather more information that may be relevant to decision-making about your child. Now, again, this independent assessment is an outside assessment and has to be considered. The school district is not required to take all the recommendations in that report and act on them, but it is required to consider all the information in it. The other thing to mention here is that it has to be, you want to ask for it at public expense, because of course you can always go hire somebody independently to do an assessment, but they are quite expensive. And while there's nothing different legally about it, the school is more likely to pay attention to a report that they've paid for than one that you've just simply had done on your own. Now, it used to be that if you asked for an IEE, it was almost automatically granted. And more school districts are willing to defend their assessments. The rule here is that if the school district refuses to do an IEE, to pay for an IEE, they must file for due process, it's a legal process, and go to the Office of Administrative Hearings and defend that their assessment was completely valid. And that process is somewhat, strenuous for the school district. So usually they're more likely to pay for the IEE. But sometimes the school will actually say, no, we don't think we need to do this. And they're willing to defend the assessment that they've done themselves. You do not have to prove your case. It's up to the school to prove their case that the evaluation is valid. It's not up to you to prove that it isn't. So the school will have some criteria for what is an appropriate test and who are people who are properly credentialed to do testing. An IEE at public expense that they pay for is automatically going to meet these criteria. If you just go to a private individual, you might want to check out the credentials of the person doing the test. what kind of testing they're doing, and just making sure that these are things that the school can actually consider when you give them the report. Now, another thing to consider is alternative dispute resolution. If you have a disagreement with the school or the school district, there generally is a process that you can make use of that does not involve having to go to a formal due process hearing or a formal mediation. Most SELPAs have a process called alternative dispute resolution, where someone who's not a district employee can come in and help resolve a disagreement between you, the parent, and the school district. And it's a formal process, but not something that has results that you have to agree with. You can make use of that process, and still, if you don't come to an agreement that something you agree with, you can still go on and take more action. Excuse me. There are also formal dispute resolution processes, such as filing for due process or filing for a state mediation, that you can take if you're in serious disagreement. So now you've gone through all this process, your child's been assessed. What are you thinking about at this point? And one thing to remember is your child is not the assessment. The assessment is not your child. Your child is a whole human being, and the assessment is going to uncover or help you understand certain things about your child. But remember that your child's strengths are more important than their weaknesses. And it's important to focus on making them shine and appreciate and do well at the things they're good at, so that they can feel good about themselves, and not put all the focus on areas where they have a weakness. We need to understand the weaknesses so that the IEP can address those, but don't make life or don't make school just about those things. Make it about all the things your child can do well and does do well as these areas where they need a little more help. And living with ambiguity, because the child's needs can be very complex, and even after the assessment, it's not always exactly clear what's going on. And to some degree, you have to just live with that and continue to observe. And as things go on, ask for more information so that things become clearer. But you may not know exactly what's going on. And even the school psychologist and the best neuropsych may have trouble really understanding what's going on. And you do the best you can. You get the best information you can, and then you work with what you can.